Mask or no mask? What kind of curtains shall I put on my windows? Single curtain or double curtain? Should I keep my doors closed or open? All these things are inconsequential if the foundation of your house is not strong. What if your house is built on a foundation of clay? It doesn't matter whether you put a single curtain or a double curtain, and it doesn't matter if your doors are closed or not, your house will come crashing down one day. What does this have to do with anything? Let's get into the video and see how we can build a durable house with a strong and sensible foundation. What are the measures that will really help us to be safe from a probable next wave of COVID? In this video, we are going to look at governmental authorities and the pandemic, the individual and the pandemic, and how we can work together to combat and defeat a probable next wave. I'm Tina from Indian LCHF. Our aim is to help you live a healthy and long life without chronic progressive disease and chronic medication. This can be achieved through food and lifestyle changes. Our motto, like Dr. Hippocrates said, is let food be your medicine. In another video, we had an analysis of the mitigative measures that authorities took against COVID. They included lockdowns, PCR testing, reporting of cases, school closures, mask mandates, vaccines, etc. And we saw that some of these measures were not nearly as effective as they were projected to be. I've discussed this in the other video in detail with data. Please go and check it out. Now, that video was made based on data that was available predominantly from developed and Western countries. In developing and densely populated countries like India, these learnings may have to be contextualized and applied accordingly. We saw in particular how lockdowns were ineffective in various parts of the world. Let's dwell a bit on that so that we can learn why and how lockdowns were ineffective in controlling the spread, so that we could use it meaningfully for the probable upcoming next wave. There are two things to consider. One is the timing, the next is the extent. The timing of the lockdown was considered off and therefore ineffective. The extent was excessive and far-reaching and therefore led to actual harm. Let us look at these two things in detail. Timing. When do you announce a lockdown? See, once the horse has left the stable, there is no point in going and closing the doors. Similarly, a lockdown is of no use if it is announced too late. Professor Michael Levitt, Nobel Prize winner in chemistry of 2013, he's a biophysicist. He says lockdown is a medieval approach. In those days, there was not fast transportation between one place and another. So if there was a contagious infection, that place was locked down so that and many other surrounding places, so that people could not carry the infection from one place to another. Now, in this time of excellent transportations and very advanced systems of transport, it may not make much sense at all. Risk management expert Tucker Goodrich says lockdown is effective only before the infection spreads. Once it enters a population, it's already in the population. Then there is no use in shutting down the city gates and closing the borders. So what could be more effective is if we time the lockdown correctly. In both 2020 and 2021, we saw in a place like India, the lockdown happened at the end of March or the beginning of April. By then, the numbers had rocketed rapidly, and then the lockdown was announced. After that, the numbers grew down slowly in May or June. Now, experts like Dr. Beda Stadler, the vaccine pope, say that this is probably seasonal. It comes in the same season every year. And in a country like India, maybe it's in the cold season of December and January or January and February. So what's the point in locking down after it has spread widely in March and April? Of course, authorities may say, but then it gradually reduced in May, June, July. But experts say that will happen anyway because that is the seasonality of the virus. It will come up and then it will gradually go down. And then people patting themselves on the back and saying, oh, this happened because of the lockdown, doesn't seem so valid. It happened probably because of the sun. The sun is shining really fierce and hard in a place like India in the months of May and June and July. So that's why it probably has come down, not because of the lockdown. So when can we time the lockdown? We could have a lockdown probably in January or February, which is the cold season. That is when the cold spreads fast. So if we have restrictive measures in place by then we could probably prevent an extensive spread in the months of March and April. This is a suggestion and an idea. Experts with information about this over many years, data about how infectious viruses like the flu virus spread, they could take the information that is available to them and authorities could time the lockdown accordingly. Next, let us look at the extent of the lockdown. Like I said in the other video, I've explained in detail and with numbers the adverse effects because the lockdown was far-reaching and excessive. But I'll mention it briefly here. When we look at life lost, instead of looking at just the number of lives lost, we also have to look at the life years lost, the number of years that have been lost. For example, if a person who is, say, 80, is frail and elderly, has at least one or more comorbidities and succumbs to a COVID infection and dies, then the life years lost is probably 1 or 2 years or maybe 5 years. But if a person dies because of undetected heart disease and has a heart attack, at the age of 40, then the number of life years lost is 40. Public Health England published a report that 200,000 life years were lost in the form of other sicknesses like strokes, heart attacks, cancer, depression, and other impacts of lockdown. There has been a reduction in the longevity of children. 7.8 million years have been lost in just a 2-month school closure, which is 3 times more than life years lost due to COVID. There has been a great deterioration in the health of children. Obesity and childhood diabetes have increased manifold, and the economic slowdown that happens because of the lockdowns. In recession, death rates increase, life expectancy goes down, and this is probably more than the dangers of COVID. So what can we do in terms of extent of lockdown that will not have such adverse effects, but at the same time, in a densely populated country like India, some measures may have to be taken. So instead of an extremely intense lockdown, we could consider these measures. For example, physical distancing. When we are in a public place, we have to maintain a physical distance of say 5 to 6 feet. If a person is infected by corona and how the droplets travel far, experts would say the amount of distance that has to be implemented. Professor Michael Levitt says that it could be 2 or 3 meters when the infection is at its peak, and then could gradually reduce to 1.5 and 1 meter and so on. For example, if the experts say let's have 5 feet distance or a 6 feet distance, in simple terms, you remember in school we used to have a 1 arm distance when we stood for a drill, or sometimes 2 arm distance. We stand like this and maintain distance. So that's the kind of distance you may have to maintain while going to a public place. And when we are within this distance, maybe a mask has to be worn. I'm not saying that I suggest this for everybody, but this is what I do. Even though I basically believe that a mask doesn't have much effect in respiratory conditions. And this we saw in the other video with data and reports. So when I wear a mask, I wear it like this. But when I'm at about 5 or 6 feet distance, I just do this. Not because I believe that that person has COVID and I am protected from him, or that I have COVID and I am preventing it by wearing this mask. I won't go out if I had it. But because it just gives peace of mind to the other person. If he sees me coming close to him and I wear a mask, then he feels like he's safe. So I do that. So we could do that. We should cover our mouths when sneezing or coughing. That goes without saying. Most importantly, I believe hand hygiene is very, very important. I cannot stress enough how important hand hygiene is. Even before this COVID and all this happened, it started off when I read an article in, I think it was the Reader's Digest. I have Reader's Digest that date from 1969 or 70. So it said how if we keep our hands clean, it's very safe, and how our hand is probably much dirtier than certain other regions of our body. For example, the anus. So at home, we have hand washes in every sink and a sanitizer, especially when our nephew was living with us, little boy. We used to sanitize our hand when we went out and made sure we cleaned our hands every time. So here are some tips for hand hygiene. Don't touch handles of doors or taps in public places. Or if you have to do that, sanitize your hand after that. So what I do when I go to a restaurant is I open the tap with the right hand. The right hand is my predominant hand. I open it, wash my hands, and then get some water in the right hand like this, close the tap with my left hand, and then with this water I wash both hands again, so that the last thing I have touched is not the tap surface. Most people open it like this with their right hand, wash their hands, and then close it again with the right hand. So there's no point in you having washed your hand. Your right hand is still dirty from germs that many other hands might have had. Similarly, I use a tissue when I open the door handle of a bathroom in a public place. Or if I don't have a tissue, or if there's no tissue in the utility, I use my elbow or my shoulders to open a door that is used by many people in a public place like a restaurant or a movie theater or a shopping mall, something like that. In our office during the flu season, what I would do is I would get a housekeeping staff to spray sanitizer on all the door handles, taps and surfaces that people commonly touch, the pantry, dining table and stuff like that. So even if 1 or 2 people had it, this would prevent the spread of cold from one person to another. So even in our homes, if one person gets the cold, then this is a useful measure to prevent it from spreading to others. And of course, don't take your hands to your face. We subconsciously do that. So make sure you don't do that. Do not forget, always carry a hand sanitizer in your handbag, in your purse, or wet wipes, something to help you keep your hands clean. That is just such an important measure for preventing a spread of a viral infection. The one thing a well-timed lockdown could achieve is prevention of overload at hospitals. It reduces the load for hospitals. Otherwise, we will go scrambling for hospitals. There's no place in hospitals, not enough space to accommodate all the incoming patients, not enough ICUs, not enough ventilators, not enough equipments. So a lockdown in a well-timed manner can prevent an overload to an already burdened healthcare system. Having said that, a lockdown may prevent a rapid spread, but can it protect you, the individual? The government can only put in place certain measures to prevent a rapid spread. But ultimately, the individual's health is in the individual's hands. Stabilizing and strengthening our immune system should happen not after the wave comes. some magic pill or potion we drink and we'll all suddenly become immune like Popeye. That's not going to happen. We have to become strong and make ourselves healthy when there is no threat or danger. So how can we stabilize and strengthen our defense forces, our immunity, before the next wave comes? In the data from the past couple of years, I've explained very clearly in detail in the other video, a tragic meeting of two pandemics, that some people were affected, some people were not. So what is the difference between these people? We saw that insulin resistance, not obesity, is the underlying condition for bad COVID outcomes. And we saw the metabolic pathways that lead to insulin and leptin resistance. And we saw also how health and immunity are interrelated. Do check out the long video to see how that happens. The people who have metabolic syndrome conditions like diabetes, obesity, heart disease, hypertension, and associated conditions are the ones who have had worst outcomes for COVID. And what is the root cause for metabolic conditions? Leptin and insulin resistance. Can anything be done about leptin and insulin resistance? Yes. A person can reverse leptin and insulin resistance and become leptin and insulin sensitive. How? By reducing the amount of leptin and insulin secreted by the body. In order to reduce the insulin and leptin secretion, what we have to do is change the food we eat. If we eat foods that induce much secretion of insulin and leptin, then we become insulin resistance and leptin resistance. If we eat foods that have very limited or low levels of insulin and leptin secretion, then we can reverse insulin and leptin resistance and become insulin and leptin sensitive. In this simple manner, we can make ourselves metabolically healthy and prevent bad outcomes in the next wave. So even if a person gets the infection, maybe it will pass off like the common cold in a couple of days instead of bad outcomes and even death. And sometimes if a person is very healthy, the immune system fends off the virus and they don't even get it, which is what is now named as asymptomatic. I've explained this also in the other video. Dr. Sebastian Rushworth, in his book, COVID, Why Most of What You Know Is Wrong, says that a lot of people who died of COVID actually didn't die of COVID. They died with COVID. That means they had a positive test and they had symptoms of COVID, but their actual death happened because of something else. It is not the virus itself that kills a person. It is the underlying inflammation in the person's body that leads to bad outcomes and even death. A highly inflamed body, instead of attacking just the virus, attacks the body's healthy cells and therefore the person dies. The only way to stop chronic inflammation and a basal underlying inflammation is to reduce insulin and leptin resistance, and that is by food. An intake of low carbohydrate and unprocessed carbohydrate foods like vegetables and eating real foods will help. I made a separate video on this. Eat real foods, please check it out. If we stop the excessive consumption of grains, especially in their refined form, we stop excessive consumption of sugar, and we include healthy and high levels of fat in our food and moderate quantities of protein, if possible animal protein, and we should also include eggs. Eggs are considered as a superfood. They are absolutely essential for white blood cell formation, which is amongst the first line of defense in fighting against infections. To strengthen our defenses, we need good food. We saw in the full-length video, A Tragic Meeting of Two Pandemics, how Dr. Ron Rosedale, remember the elder son of Mukesh Ambani, his weight loss journey? It was an amazing transformation. Dr. Ron Rosedale is the consultant physician of that family. Now he says how eggs are important and how food change can help not only patients in hospitals with COVID, but people at home with COVID, and also as a preventative measure to not get COVID. So that is what the individual can do to protect themselves, to fortify themselves, and to make themselves so strong that COVID will not be a problem. On the other hand, how can governmental authorities help? We saw in the other video, which is a review of the measures that were taken by governmental authorities and their results, that definition of case may need to be changed and other testing measures may need to be adopted. I've explained in detail in that video, but I'll mention here in brief that a PCR testing method is extremely sensitive. It amplifies by around 20, 30, even 40 cycles the presence of a viral genome. It doesn't say whether the virus is live or dead. So a person without symptoms sometimes get a positive test, and what that means is that the test has picked up on the traces of the dead virus in their body. They have been strong and their immune system has defeated the virus. So there is dead virus in the body, but this PCR test is so sensitive that it's picked them up. They have been reported as positive. Another issue is reporting of cases. Now if a person gets a cold, he just goes to work normally sniffling his nose. If it's a bit severe, he may be advised rest for a couple of days, don't go to work. Just because he has a cold, he doesn't come into the statistic of people with cold. No, he had a cold, he's just at home. However, a person is classified as a case when the cold becomes so severe that they require hospitalization, they require hospital care, or maybe they need to be in the ICU, or sometimes people may even die of the flu. That is what should be called as cases. Now, in current reporting scenario, even the people who have just tested positives have absolutely no symptoms, which means, like I said earlier, they are healthy, their immune system has defeated the virus. They are being counted as cases, and therefore this number of positive cases is highly inflated and blown out of proportion. What is the logic in taking a healthy person and combining them with the number of unhealthy persons? These two don't make the same number. This is opposite to this. This person is healthy, he hasn't been affected. This person has not been healthy, he has been affected. How can we put both these numbers together? This is like the cholesterol problem. They say good cholesterol and then bad cholesterol, and then put them together, the good and the bad. They combine those numbers and say total cholesterol. Now here, take a statin, take a rose-colored tablet every day of your life, because you've combined the good numbers and the bad numbers. How can they get together? So combining these numbers really doesn't make much logical sense. So the governmental authorities should put in place a definition to what constitutes a case, and a testing system, for example, a viral culture that is called the gold standard of testing viral infections, to be implemented before classifying a person as having the infection. If that is done, then people without symptoms are not asymptomatic spreaders. They are people who haven't been affected. The virus hasn't touched them. Second is the availability of good sources of food for people with reduced financial means and people below the poverty line. We have a good public distribution system, and experts and governmental authorities who have worked with this system for so many years and who have the experience and the education and are equipped to do this could find some method of distributing or reducing the price and making available sources of protein like eggs. Eggs are a part of a midday meal scheme. If there is some way to distribute eggs, which are a good source of protein and good fat and extremely important for the manufacture of white blood cells, which help immunity, if there is some way to distribute eggs to people in lower income groups, then that would be good. And if there can be some kind of cap that can be placed on certain sources of protein like meat proteins, so that people can afford to buy some meat as a source of protein. Dr. Vivian has spoken about the importance of bone broth in immunity in the video, Tragic Meeting of Two Pandemics. Go check it out. If some method of a price cap on bones can be placed so that people can make bone broth and improve their immunity, such measures would be greatly helpful for people in lower income groups. Another thing that governmental authorities can do is time the lockdown right. If they can anticipate a spread before it happens and restrict public meetings, religious meetings, worship places, mass religious events, election campaigns, and such stuff before it happens, that would be a well-timed lockdown which could be very effective. And maybe, like Dr. Beda Stadler says, governmental authorities should consult not only epidemiologists but also immunologists regarding the mitigative measures that they have to take to reduce the spread of this infectious virus. Maybe immunologists will help us ramp up and better our immunity, so that instead of running away from the virus or trying to run away from the virus, we can try to lead as normal lives as possible, but the virus will not affect us adversely. One more thing we have to do is not allow ourselves to be ruled by fear. We have to stop being afraid. We have to be sensible, but at the same time not be panic driven. To gain a sense of perspective, let us look at what Professor John Ioannidis, physician, scientist, writer, and Stanford professor, says about COVID in comparison with the 1918 flu. The 1918 flu was 14 times deadlier than COVID-19. Another point to note is the average person who died from COVID complications is 80 years old and has underlying metabolic health conditions of metabolic syndrome called comorbidities, whereas the average person that died from the 1918 flu was in their late 20s. So each death in the 1918 flu pandemic meant that around 50 years of life were lost per person than the COVID pandemic. When we gain this sense of perspective, we understand that COVID is probably much more hyped than it needs to be. The numbers we saw by reporting and the testing, that the numbers are highly inflated, the wrong numbers are joined, and that there has been an unnecessary fear mongering and panic amongst people. We need not panic. Ivor Cummins in the movie COVID Chronicles says, if you switched off media, you wouldn't even know that there was a pandemic. Seriously, if you switched off the TV, you didn't get the newspaper and didn't see Facebook, Twitter, and private messaging like WhatsApp and Telegram and all of these, you won't know there was a pandemic. Of course, it's not nothing. It has had an impact, but it is being projected much more than it really is. If authorities and mainstream media project numbers based on PCR testing and positive results from the PCR testing as cases, then this pandemic is probably never going to end. We also saw in the other video how school closures has affected children, and that a report based on modeling from a school strike in Argentina affected the longevity of children. Based on those numbers, the model says that 7.8 million life years are lost. That's 3 times more than the COVID life years lost numbers in just 2 months closure of schools. So school openings is something that the government should consider, and with safe protocols in place and some kind of normal functioning of schools would be better. These measures like lockdowns and vaccines have their place and importance, but projecting them to be the only thing is very misleading to us. Let me give you an illustration to help you understand this easily. Suppose I live in a house. Let me close my windows with 1 curtain, 2 curtains. Let me lock my doors, and that way I will be safe. You can put how many ever curtains you want. I'm comparing that to masks, obviously. And you can close your doors. That's lockdowns. But if your house foundation is made of loose sand or clay, which is a very weak substance for a foundation, then your whole house will come crashing down. Then keeping double curtains on your windows and closing your doors is of no consequence or importance. So if you want a strong foundation for your house, you have to build it on rock, stones, and then we can talk about closing our windows with double curtains, covering our face with double masks and shutting our doors and staying inside. So what is the strong foundation? This strong foundation for our body is our metabolic health. If our health is good, if we do not have chronic diseases that degenerate our body like obesity, diabetes, hypertension, heart disease, and all other conditions associated with metabolic syndrome, then our foundation is strong. Once we have a strong foundation, we need not be so panic driven and afraid. It may come, it may not come, and if it comes, it will have slight effects and we will lead our lives normally, just like a common cold hinders our normal life for 2 days. That's it. So building a strong foundation, strengthening our health and our immunity is of utmost importance. All these small measures like masks and lockdowns give people a sense of pseudo security. They feel like they are safe, whereas their foundation is crumbling and shaking. And as soon as a lockdown is announced, people in supermarkets buying bags of chips fried in vegetable oils that are high in omega-6, which increase the inflammation in the body. Snacks, sweets, grain products, wheat products, refined wheat flour to make loads of chapati, noodles, biscuits that are high in sugar, and all kinds of snacks, kara chev, kara bundi, ready-made chapati, chocolates, murku, bakoda, you name it. People are loading up on stuff that is going to make their health even worse than it was before the lockdown. So people put on Facebook, staying at home, saving lives. You're not saving anybody's life by just staying at home. Save your own life by becoming healthy, losing weight, reversing conditions like insulin resistance, diabetes, hypertension, and heart disease. There are some people who can afford to stay at home because you have work at home options, you have a good internet connection, and you have a job that helps you work from home. An intense lockdown affects the livelihood of so many people. There are people who cannot afford to stay at home. They have to go out to work in order to earn money to eat. Day wage laborers need to go out to work in order to earn that day's income, that week's income. That will provide them food for their families. There are people who don't have refrigerators and freezers to stock food for 2 weeks of lockdown. They have to buy food every day. They have to earn money every day. We saw the dead bodies of migrant laborers. We saw how intense lockdowns affects the livelihood of people. We saw how women from middle income groups, when their husbands and they lost their job, they had to resort to the sex trade just to keep their family members alive. Apart from a sense of false security, it also gives them a sense of misplaced righteousness. Oh, that man, look at him, he's not wearing a mask. So they go up on the street and tell somebody, wear a mask. Why are you not wearing a mask? Here they are sitting inside their car, eating badusha and oats and looking at a man who's going in a bike. There is nobody near him. Why should he wear a mask? People are wearing masks and jogging on the streets. When you're doing intensive exercise like walking fastly or jogging or in the gym or any other exercise, wearing a mask is going to prevent fresh intake of oxygen. It enables rebreathing of one's own carbon dioxide and therefore is not good for health. Like Dr. Vivian Jayachandran says, our health is in our hands. There is only so much doctors can do. There is only certain measures that governments can take to prevent the spread. But ultimately, our health is in our hands. If we eat low carbohydrate, highly dense carbohydrate foods, mainly from vegetables, and healthy high fats, we can improve our health and our immunity and prevent the next wave from affecting us badly. Your health is in your hands. To know more about the LCHF lifestyle, which includes LCHF foods and fasting, go to our website. There is an extensive food list and many videos and information on fasting. Check them out. Get yourselves equipped with knowledge and get yourselves healthier. So a well thought out, low extent and well timed lockdown by the authorities and our own individual efforts to improve our health will go a long way in fighting not just the next wave, but any other such viral epidemics in the future. And it will improve our health and help us to have a healthy and long life. Thank you.